Good morning, students. Ну, наверное, вот. Проверьте. Нажал кнопку.
Лучше будет сделать так. Здесь пишут.
Ага.
Не могут там какой-нибудь вопрос задать, чтобы вы просто увидели.
То есть все, трансляция идет?
Да.
Все. Спасибо. Спасибо. Good morning, students. From this semester you start learning general surgery. This is basics of surgical discipline, and I'm going to deliver you a cycle of lectures about general surgery. Today I recount a lecture for asepsis and antisepsis and basics of infection control in surgery. You have a notion of surgery as a discipline and as a science, and you have to know the difference between therapeutic disciplines and surgical ones. Surgery is a science and branch of medicine that deals with invasive methods of treatment, and main principle of surgical operation is invasion into internal environment of human body, and you should know side effects of surgical operation. First, regarding to today's lecture, first side effect of surgical operation is infection. Infection process takes 6 parts. This is interaction between human body and bacteria, which presents around the human body and during surgery may touch to operation wound. First part of the lecture devoted to asepsis. Asepsis. First part of the lecture, asepsis. Preface to asepsis, small short historical review. With the discovery that microorganisms cause infection, to prevent of disease or postoperative complications, it is necessary to inhibit or stop their growth and reproduction. The method of aseptic technique initiated by Joseph Lister helped reduce morbidity and mortality from surgery and wound care. Lister, as you know, Lister is known as the father of aseptic technique. Any patient entering a healthcare facility is at a great risk of developing an infection because of lowered resistance, increased exposure to numbers and types of disease-causing organisms, or their need for any invasive procedures. Infection prevention and control consists of the procedures in hospitals and other healthcare facilities to minimize the spread of infections to patients and other staff members. Microorganisms naturally present on and in the human body, as well as in the environment. So during treatment, surgical treatment, we cannot avoid invasion of bacteria into organisms, and we cannot eliminate bacteria completely from body, but we can sterilize environment and we can sterilize surgical tools and equipment taking part in surgical operation. Many of these microorganisms are non-pathogenic, means harmless. They don't cause any disease, just presence on on and in body, and in most individuals do not produce disease. Some of them, means some of the bacteria, can be pathogenic, means harmful. They are also known as pathogens that do cause specific disease or infections. From microbiology course, you know that there are two types of bacteria, non-specific and specific. Specific bacteria do cause specific infections such as tuberculosis or anthrax. Non-specific bacteria or trivial microflora cause non-specific purulent infection of soft tissues. Chain of infection. What is a chain of infection? For a microorganism to be effective in containing contamination, it follows a definite chain of events. Chain of infection is a totality of events, complex of events. The following 6 elements are necessary for infection to occur. 6 elements. First element, the infectious agent, properly a pathogen. Bacteria, means bacteria, non-specific or specific. Second part is a reservoir, means where the pathogen can grow, where the bacteria persist and multiplicate, proliferate. Exit route from reservoir is a pathway from harbor of infection to susceptible host. Fourth step, method of transportation such as air droplets, hands and needles or implants. It means how bacteria get into a susceptible host from one person to another person in case of endogenous infection, and from the environment to host to the patient in case of exogenous infection. Fifth step, entrance of bacteria into the body through skin, mucous lining or mouth. And last step, host. Properly is a susceptible host, susceptible organism, patient, another person that accepts bacteria and produce response, inflammatory response to the bacteria. To prevent the spread of a microorganism, the cycle must be interrupted through daily practices of medical asepsis. The practice helps to inhibit the growth and reduce the number of microorganisms. So it helps to reduce post-operative complications, side effects, local diseases, infections, and general response to infections such as systemic inflammatory response or sepsis. Now, first step of chain of infection, infectious agent. All the microorganisms require food for growth and a suitable environment in which to live. Contaminated hands, wound dressings, instruments or medical equipment provide ideal areas for pathogenic growth. Bacteria have any different characteristics. They have 3 basic shapes, round, oblong and spiral, so we can recognize type of the bacteria under the microscope. Is a base of microscopy as a method of intra-hospital diagnostic of infection, type of infection. Bacteria also frequently have different chemical compositions, require different nutrients and form different waste products. That is why we can differentiate various types of infections, because of various types of sorts of bacteria produce various toxins proper only for them, and produce different types of inflammatory responses. Aerobic bacteria grow only in the presence of oxygen, whereas anaerobic bacteria grow only in the absence of oxygen. Some bacteria form a specialized structure called a spore. The spore is a round body that is formed by the bacterium when conditions are unfavorable or growth of the bacterium. Characteristically, spores have a high degree of resistance to heat and disinfectants. Spores protect the bacteria from adverse environment and keep vegetative forms inside their capsule, inside the spore, for survival, for their survival. Second part of chain of infection is a reservoir. Any natural habitat of a microorganism that promotes growth and reproduction is a reservoir. The habitat can be exogenous. Reservoirs of infection can be exogenous, it means placed outside of a human body, in the environment, or endogenous, inside of a human. Many areas of the body, for example skin, respiratory tract and gastrointestinal tract, typically host a variety of microorganisms as gram-positive and gram-negative. Examples of exogenous reservoirs are dressings and hospital equipment such as a bedside stand, an overbed table, suction equipment, or urinary drainage bags. Examples of endogenous reservoirs are skin and mucosal linens, gastrointestinal tract and respiratory tract. Naturally, these sites is a habitat for infection. We have a lot of saprophytic microflora that presence in the infected sites and protect us from transient flora, from pathogenic infection. Third step in the cycle of chain of infection is the exit route. A microorganism does not have the capacity to cause disease in another host without finding a point to escape from the reservoir and touching to susceptible host with one or multiple methods of transmission. Transmission means traveling process of traveling of bacteria from one host to another host, to next host. Exit routes in humans are the gastrointestinal, respiratory and genitourinary systems, infected or inflamed tissue, blood and wound discharge. Any body liquids, infected body liquids, contaminated, can be exit routes for infection and can, via the liquids, the bacteria can infect another person in the hospitals. Methods of transmission. Fourth step of the chain method of transmission. It is the means by which microorganisms are transported to the next host once they have left the previous reservoir of infection. For exogenous infection, there are three variants, three methods of transmission. Airborne transmission may involve droplets or dust. Contact transmission, direct contact of the host and contaminated instruments, catheters, aspirators, gloves, etc. Implantation transmission, implantation of contaminated artificial subjects such as metallic plates, screws for metal osteosynthesis, artificial joints made of ceramic or metal, threads for sutures, meshes for strengthening of abdominal wall, pacemakers, and other devices. Endogenous infection spreads through the following means. Hematogenous way, along with bloodstream, infected blood can transmit bacteria. Lymphogenous, along with lymph node, for example, characteristic hypertrophic ulcers, lymph node transport infection, the trophic ulcer, and contact infection due to direct contact of bacteria infected sites of body with non-infected, clean, aseptic sites of the body during surgical operation. In this case, we can meet post-operative inflammation of operation wound or infection of urinary bladder due to pyelonephritis or due to long-term catheterization of urinary bladder. Next step of chain of the infection, entrance of microorganisms. The microorganism has exited the reservoir and has been transmitted to the susceptible host. It has to find a way to enter into the next host. When the host's defense mechanisms are reduced, the microorganism has a greater chance to enter and be absorbed into the bloodstream. The following manipulations can make a portal for entry of bacteria. First, this is surgical incision, first invasive part of any surgical operation, surgical approach to affected organ. This is surgical incision, accompanied with breakage of skin or mucous linens. Catheterizations, invasion into vessels, stomach or urinary bladder, placing of catheters and drainage tubes to the hollow organs and blood vessels. Cavity or wound drainage, drainage of pleural cavities, abdominal cavities for ascites, pleural cavities for pleuritis, can infect the cavity. Bacteria can travel along the drainage and infect the internal environment, internal cavity. Tracheal intubation. Any major operation should be done under general anesthesia, and anesthesiologist must intubate the patient to give good narcosis for the patient and good narcosis for convenient narcosis for the surgeon to perform his operation very good. Host. Last step of chain of infection, host. Host is an organism in which another organism is nourished and harbored. Susceptibility to an infection is defined by the amount of resistance shown to the pathogen. Microorganisms are constantly in contact with people, but an infection will not develop unless a person is resistant to the microorganism's strength and their numbers. As the pathogen's strength and numbers increase, the person becomes more susceptible. Any operation reduces immunity, reduces response, reduces resistance of patient's tissues to infection. And that is why very important to observe rules of asepsis during surgery. As a result of invasion of bacteria, if the chain of infection was successful, bacteria touch to organism, internal spaces and tissues, organs, and produce a response of body to infection. Inflammatory response is the universal type of reaction of a host to organism, to bacteria. When a patient acquires the infection, there are signs and symptoms that can be seen. Clinical presentation of infection. The body's response to infection is inflammation. Inflammation is a protective vascular reaction that delivers fluid, blood products and immune cells to the area of the invasion. The inflammation neutralizes and eliminates pathogens or necrotic tissues. Signs of local inflammation frequently include edema, swelling, redness, hyperemia around the center of invasion, heat, local hypothermia, pain in the affected body part. The inflammation becomes systemic. Other signs, when the inflammation becomes systemic, other signs and symptoms develop, including fever, leukocytosis, anorexia, nausea, vomiting, and lymph node enlargement. So we can observe two types of infection due to invasion of bacteria. local symptoms, local inflammation, and general response, systemic inflammatory response to bacteria. In infection control, we used terms, definitions. So there is a commonly used terms to infection control. You should know the difference between them. First definition is decontamination. Is a destruction or marked reduction of microorganisms in their number or activity. Disinfection, chemical or physical treatment that destroy most vegetative forms or viruses and bacteria, but not spores in or on the inanimate objects. Sterilization, elimination of all types of the microorganisms, including spores in or on the inanimate objects. Properly asepsis, methods which prevent contamination of wounds and other sites of the host by ensuring that only sterile object and fluid come into contact with them. And antisepsis, techniques of elimination of the pathogens from tissues inside the host. Asepsis. Asepsis is a basic of surgery, is a basic of preparation of patients for any surgery. So, definition of the asepsis is a complex of measures, complex of methods that prevents contamination of wound and other sites of the host. There is an indispensable rule in surgery. Only sterile objects and fluids can be involved into contact with the patient. Asepsis prevents coming the pathogens from environment with the following ways. Methods of prophylaxis of airborne infection may involve droplets or dust. Prophylaxis of contact infection, we should provide prevention of contact infection. This is direct contact between host and contaminated areas of out of the patient. And implantation way. Implantation means incorporation any contaminated materials, artificial materials, inside the body. Prevention of airborne infection. Prevent transmission of bacteria through air, through droplets or dust. First rule of organization of work in the hospital. Aseptic, clean patients and infected patients with purulent diseases must be treated apart from each other to exclude cross-contamination, transmission of bacteria from one person, from infected person, to another person. Protective mask reduce discharge of infected respiratory secretions from a nasopharynx and oral cavity. Wearing mask reduces discharge of bacteria and number of bacteria into air. Bactericidal lamps. Ultraviolet rays destroy microorganisms in air and on open surfaces when touched to them. Ventilation of premises reduces bacterial contamination of air, means exchange. You should exchange air in premises of hospital and clean air to reduce number of bacteria and concentration of bacteria into air circulating inside the premises of hospital. Personal hygiene and medical uniform of medical personnel and patients. And wet cleaning in hospital premises. Washing of premises with disinfectant solution, with disinfectants, for elimination of bacteria in the environment around our patients. Next type of exogenous infection is a contact infection. How to prevent the spreading of contact infection? We should perform methods of sterilization and decontamination. Prevention of contact infection consists in elimination of the pathogens from any surface that involved in contact with patient. We can do two techniques. Sterilization technique, we can apply the sterilization to surgical instruments, surgical garb, gloves, and dressing material. So for preparation of hands and skin, doctor's hands and patient's skin. For surgical scrubbing and sterile field preparation of patient's body, we should use decontamination. How to perform sterilization? First method, the most important method in surgery for prophylaxis of infection is sterilization. Steps of sterilization: cleaning, disinfection, and properly sterilization. Cleanliness is the absence of dust, soil, debris, or other body fluids and blood. The process of cleaning removes those substances from equipment, surfaces, and instruments in the perioperative environment using friction, detergent, and water to remove organic debris. Cleaning must occur before disinfection and sterilization. Can be accomplished to reduce biofilm and remove foreign material that interferes with the sterilization process. To make the sterilization more efficient, we should prepare instruments and equipment for sterilization. We must prepare them with cleaning and decontamination. Steps of cleaning. Rinse the contaminated object in running water to remove organic contamination. Flow out the biofilms with running water. Wash the object, sterilize the object with soap in warm water. Soap or other detergent emulsifies dirt and organic material from their surfaces. Use a brush to remove dirt or any material from grooves or seams of the item, of the object. And friction dislodges contaminated material for easy removal. After that, rinse the object in warm water again to remove the residual amount of detergents, soaps, and other detergents. And finally, dry the object and prepare it for disinfection and sterilization. Second step of prophylaxis of contact infection is disinfection. Already cleaned instrument should be disinfected to reduce a number of vegetative-formed bacteria. Disinfection cannot destroy spores of bacteria but can greatly reduce number of bacteria with chemicals, disinfectants. Disinfection is used to destroy the pathogens, but it does not destroy their spores. Chemicals used for that are called as disinfectants. Drugs are appropriate for disinfection, for application on inanimate surfaces only. These solutions are too strong for human skin and they cause chemical burns and chemical damages of the skin. The following solutions should be used for disinfection. 1% solution of chloramine B, bacillol, alaminol, Silex or ultracid. Technique of disinfection is immersing of instruments and objects into tank with disinfectants. After disinfection, we should rinse the instruments and other equipment in water to decrease concentration to remove disinfectants from their surface. And now we can start sterilization. Sterilization is a process that provides the highest level of assurance that surgical items are free of viable microbes. Sterilization is one of the most critical processes to prevent surgical site infection. Effective sterilization requires appropriate instrument cleaning and decontamination before sterilization occurs. And after the instruments will be ready for sterilization, we should choose the method of sterilization. As you know, we have physical factors and chemical factors of nature, and we can use some of them for sterilization of instruments. Physical factors. We can use heat. Heat is the most reliable method of sterilization, the most widely used in medicine, in two forms: dry heat sterilization or moist heat or steam sterilization. Other physical factor is irradiation. Irradiation can be non-invasive, ultraviolet radiation, non-ionizing is ultraviolet radiation, and invasive radiation, gamma rays. Chemical methods appropriate for disinfection and instruments, especially optic instruments. We can use antiseptic liquids and gases. We can use volatile drugs, volatile substances such as gas, ethylene oxide gas, or vapors of formaldehyde. Technique of dry heat sterilization, air heat sterilization. The method is effective because dehydration effect of the method becomes due to dehydration and oxidation of their pathogens and denaturation of their proteins. The method is used to sterilize objects which do not get damaged by high temperature. Objects made of laboratory glass, metal, such as scissors, clamps, forceps, retractors, blade holders, and other metallic equipment. The sterilization is complete if these two factors are achieved inside the chamber for sterilization. Temperature in air heat chamber should be not less than 180 degrees, and the exposition time duration of heating should be not less than 60 minutes. 1 hour and 180 degrees, this is regime of air heat sterilization. Another conductor of heat is water steam. We can boil steam and use water steam in high temperature for sterilization of equipment and instruments. The method is named as autoclaving. Autoclave is a device for steam sterilization. Water steam is an effective method of sterilization because it causes denaturation and coagulation of any proteins. Some properties characteristically for the autoclaving. First, this is high penetrating capacity of water steam into structure of material, for example, dressing material. It gives large amount of heat to any surface it comes in contact with. Because of good penetration, the water steam delivers heat into deep layers and can sterilize dressing material, surgical garb for surgical operation. Autoclaving is a very good method for sterilization of dressing material, surgical garb, rubber or plastic tubes, metallic glass or plastic instruments. Any material can be sterilized, except biological mediums can be sterilized by autoclaving. To achieve sterility, the exposition must be not less than 45 minutes at 120 degrees temperature, or 20 minutes at 132 degrees Celsius. Temperature of steam should be above 100 degrees for efficient sterilization of equipment and instruments. Other physical factor is physical radiation. Two types of radiation, ionizing and non-ionizing. Gamma rays produced by radioactive isotope of cobalt-60 radiation has good penetrating ability in solids and liquids. Used extensively in commercial preparation of drugs, biological products and disposable plastics in factories. commercial usage of the method. In hospital, the method is not used because the method is very expensive and very dangerous to personnel and environment. This is no increase in temperature inside the sterilizer, so thus the method considered as cold sterilization. Do not damage structure of material due to high temperature. And other method, non-ionizing radiation, ultraviolet rays. We cannot use hermecidal ultraviolet for sterilization, but we can use the ultraviolet radiation for keeping of instruments in sterile condition. Ultraviolet destroys pathogens' DNA and used mainly for air purification and keeping of already sterile instruments that had been sterilized before. In our hospital, we have special chambers, ultraviolet chambers for keeping instrument in sterile condition during working day. Chemical sterilization. We can use volatile substances such as gases and vapors. We can use formaldehyde as a source of vapors, and ethylene oxide. They used almost exclusively to sterilize medical products that cannot be sterilized by heat in factories and inside the operation theater or in sterilization room. Mechanism of action of the chemical sterilization. Chemicals destroy the pathogens by alkylation and denaturation of their nucleic acid. Plastic, rubber and photographic equipments can be sterilized by this method. Also used for mass sterilization of disposable items, single-use items such as plastic syringes, needles for injections, catheters, intravenous catheters, urinary catheters, for sterilization of blades to avoid their damage by high temperature. And the method can be used inside hospitals, in our sterilization rooms. In operation theater, we also have gas sterilizers for routine, for daily technique of sterilization. What chemical solutions we can use for chemical sterilization? Liquids. Action of the chemicals is non-specific. They cause damage of cell membrane injury and coagulation and denaturation of proteins of the pathogens. Chemical sterilization is provided by soaking the tools, immersion of the tools into chemicals and keeping them inside for necessary exposition. For chemical sterilization, they use 3% of gigasep solution. Exposition should be 60 minutes. 2% of neodishosept active, 45 minutes exposition. And 2.4% of peromull solution, 1 minute exposition. Very strong dark, very strong solution, very strong liquid. And 1 minute is enough for sterilization of instrument in the peromull. 96% of ethyl alcohol, 2 hours long, sterilization takes 2 hours, and Silex, 4 hours long. All the drugs can be used in the hospitals. Technique of sterilization is very simple, just soaking of the instruments and non-absorbable tools, equipment into tanks with antiseptics for sterilization, for cleaning of their surfaces. Their surfaces becomes clean, free from bacteria. Second origin of contact infection, next origin, is the skin. Skin of the doctor, his hands, and skin of the patient, his operation site. Operation site is the anatomical area. For that, the doctor performs incision or surgical approach. At first, before surgery starts, the doctor must sterilize his hands, decontaminate his hands with a special technique. What is a surgical scrubbing? Normal microflora on hands includes resident and transient bacteria. Resident flora are attached to deeper layer of the skin, are more resistant to removal and less likely to be associated with infections. Resident flora is a doctor's own flora. Transient bacteria that colonize the superficial layers of the skin are more likely to be removed by hand hygiene. Transient flora responsible for contamination of a wound. Colonization is the presence of microorganisms in or on a host with growth and multiplication, but without tissue, invasion or damage. Bacteria just presence on the skin. Hands of healthcare workers may be persistently colonized with bacteria flora from gram-negative and gram-positive bacteria. The use of appropriate hand hygiene reduces the number of transient bacteria on the hands. Before surgery, the doctor must perform scrubbing, surgical scrubbing. Proper hand scrubbing and sterile gloves make the best possible barrier for a surgeon against pathogens from the patient's blood, to prevent blood-borne infection, to prevent of infecting of a doctor from the patient, and for a patient against bacteria from the surgical team. The following steps should be done for surgical scrubbing. 4 steps. Wash all the hands in water with antibacterial soap during 1 minute for each hand. You should wash your hand. Each hand should be washed 1 minute in running water and soap. Next step. Dry the hands with sterile napkins. It's very important to exclude diluting of chemical that will be applied after washing in water to avoid decrease of its concentration and not sufficient effect. Then you can decontaminate the hands with medical antiseptic solution during 2.5 or 3 minutes. You should apply antiseptic solution only on dry and clean skin. And after necessary exposition, you can don sterile gown and sterile gloves with assistance of the surgical nurse. Technique of surgical scrubbing. Technique involves 6 movements, 6 steps. You can use this technique for washing in water with soap and for rubbing of antiseptic solution on skin of your hands. 6 position of your hands. Main movement is friction. You should apply palm to palm and perform frictions between dorsal surfaces of palm, first position, right palm over left dorsum and left palm over right dorsum, and also you should perform some frictions. Third position, palm to palm, fingers are interlaced. Fingers of both hands should be interlaced to each other. Fourth step, backside of fingers to palm with fingers interlocked. The same movement you should do to your other hand. Position number 4. Position number 5. Rotational rubbing of the thumb, clasped by opposite palm. The same you should do to other hand. And last step, twisting of clasped fingers in opposite palm. The same movement you should do with other hand. So we have 6 movements, 6 positions. This is universal international technique of hand scrubbing. The method is used in any countries, in any surgical departments. The method is accepted in any countries, in any hospital. You can use this method you can find this method with small variations in your hospital when you start working as a doctor. Now take a break for 10 minutes and we will start second part of our lecture devoted to antisepsis. Okay, let me resume my lecture. Second part of the lecture, antisepsis. Antisepsis is the second important part of surgery that includes struggle with infection inside the host, inside body of your patient. You should be able to eliminate a bacteria from body of your patient because during surgery we cannot avoid contamination of our patients, but we can reduce risk of contamination. We can reduce number of bacteria and their strength, so they won't begin inflammatory response. Antisepsis, basic definition to antisepsis, is a technique of elimination of the pathogens from the host. Antiseptics, bactericidal chemicals with sufficiently low toxicity for host cells, so they can be used directly to skin, mucous or mucous linens or wound. Antisepsis is a method of treatment. Antiseptics are drugs, chemicals, tolerant to soft tissues, tolerant to skin and internal organs, so they can be applied into internal cavities, into tissues, into wounds, into whole organs. Classification. Antisepsis can be classified into 5 types. According to type of vector we use for treatment of bacteria, for elimination of bacteria. We can distinguish mechanical antisepsis, physical, chemical, biological, and mixed. We can use isolated drugs, isolated methods, or we can mix or combine some of them during surgical treatment. First method of antisepsis is mechanical antisepsis. Is handling with soft tissues and organs for removal of necrotic tissues and contaminated exudate as growth medium for bacteria. You should remember that bacteria cannot be removed by mechanically. We can remove medium in which bacteria presence, medium which harbor and nourish the bacteria. In wound in organisms, necrosis and exudates are mediums for colonization, for presence of bacteria. If we remove dead tissues, because inside the dead tissues no blood circulation, no immune factors can be delivered to necrotic tissue from blood. Liquid, the same situation. No fresh blood touched to liquid, touched to exudate, and no immune factors presence in the liquid. So the necrosis and exudate, pathological exudate, are very good medium for bacteria. We should create conditions and we should handle with wound for elimination of mediums for bacteria. Technique of the mechanical antisepsis. Preparation. How to prepare of a wound for surgical treatment. At first, rules of asepsis. You should create aseptic technique around the wound. You should sterilize skin around the open wound, open damage, and you should keep the sterility during surgery, during operation. And second, you should restrict sterile field from non-sterile area by sterile linen. It means draping of the wound. You should create sterile environment and keep them with draping of the wound. Next, anesthesia. Any manipulations with open injury should be performed after anesthesia. At first, you must anesthetize of injured area to make your manipulations painless for the patient. After the injured area was anesthetized, you must perform surgical operation. Wound examination and debridement. It means you can use your hands, your fingers, and your instruments for inspection of the wound, for defining size, shape, deepness of the wound, structure of the walls of the wound and bed, to differentiate anatomical structures, to find additional leakages and pockets inside the wound, cavities, small cavities with isolated exudate, for proper drainage of them. After that, you should perform inspection and reveal necrosis, necrotic layers. You can use any methods for necrectomy, mechanical or physical method. Physical necrectomy, but all necrotic tissues must be removed, because necrosis is a medium for bacteria, surface for invasion of the bacteria. After manipulation, you must perform final hemostasis. You must stop the bleeding, even you should try to stop capillary bleeding with chemical hemostatics. Before final step, before exit of the operation, the wound of your patient must be clean and dry, empty from pathological exudate and blood clots. And you should finish surgical operation by reconstruction of anatomical structures, means suturing of the wound layer by layer, means you can stitch only muscles to muscles, fascias with fascias, skin with skin, subcutaneous fatty tissue to subcutaneous fatty tissue, to opposite portion of the tissue. You can finish operation with various types of drainages, drainage of the wound, and obliterate the dead space. Dead space is a cavity after stitching that appears after stitching of the wound and placed between wall, bed of the wound, and stitches. You must obliterate all the dead space by drainages and by proper stitching of the wound layer by layer. And after stitching of skin, you should cover the wound line of sutures with hygroscopic sterile bandage for protection of the wound from exogenous contamination and for absorption of the exudate, which will pass through the small gaps between interrupted sutures. Second type of antisepsis, physical antisepsis. We can use some physical factors that help to kill bacteria directly. They can kill bacteria, eliminate bacteria directly, or we can create conditions postoperatively for spontaneous elimination of bacteria. First factor or physical factor is hygroscopicity. We can use hygroscopic dressing material for involving of exudate during surgery and for aspiration of exudate after surgery through line of sutures. Any dressing material should be made of gauze. Gauze is a very good absorbable material, and the material will absorb any exudate come out from the wound. Hypertonic solution. We can use hypertonic solutions of sodium chloride. 10% of sodium chloride. We can moist hygroscopic material with hypertonic solution. Thus, we can increase absorbable properties of dressing bandage. Ultrasound cavitation is a method which uses physical factor ultrasound irradiation. Ultrasound is a irradiation that helps to differentiate of anatomical structures. We can use for diagnostic purpose or for treatment purpose, because side effect of ultrasound irradiation is a cavitation to liquids and tissues. Method is based on application of water sterile saline solution into wound, and placing of device for ultrasound irradiation of cavity, wound cavity. Ultrasound waves will touch to solution, saline solution, that will transmit the waves to walls of the wound, and irradiation of necrotic walls of large wound can perform physical debridement. Dead tissues, dead cells will detach easily from each other and from healthy tissues by ultrasound. And after procedure, the procedure takes 10 or 15 minutes. After finishing of the procedure, we should remove content of the wound, saline solution, together with cellular debris. The method is indicated for treatment of deep necrotic wounds in subcutaneous fatty tissue. For example, from very deep and massive necrotic diseases, purulent necrotic diseases, phlegmones, abscesses, bed sores. The method is very simple and very applicable for treatment of necrotic diseases. Application of sorbents. Sorbents, drugs for absorbing and inactivation of toxins and bacterial cells. We can apply sorbent into wound. Application is topical only inside the wound. We can apply the sorbents into wound, and the sorbents will absorb toxins and bacteria from the wound. And after period of time, we should remove the sorbent from the wound. We should clean the wound and apply next portion of sorbent. It's a method of wound detoxification. And last method of physical antisepsis is drainage. Drainage is a condition where post-operative condition when the exudate together with bacteria spontaneously flow out from the wound into the environment. For proper drainage, during surgery, we should create conditions. We should place drainages. We can distinguish three types of drainages, three types of physical drainage. Passive drainage. It means gravity involves liquid from the wound, any liquid from the wound, together with bacteria through plastic tube. Proximal tip of the tube is fenestrated and placed inside the wound. The wound is stitched closed by sutures, and gravity will involve pathological content through the tube into a jar. Active suction drain. We can connect a vacuum aspirator to the distal tip of the drainage tube, and vacuum aspirator will involve under pressure. It will aspirate content of the wound, pathological content. We can use electric aspirator or rubber aspirator. And last type of drainage is a flowing drainage, flowing type. We should use two tubes. Proximal tube, one tube is placed over the patient. Bed stand, we can put a bottle with sterile saline solution or antiseptic solution on the bed stand, connect to proximal tube, and gravity will involve the solution from the tube into wound. From another tube, from distal tube, the gravity will evacuate inflammatory, contaminated content from the wound into environment. The flowing drainage is used for treatment of chronic inflammatory and chronic necrotic diseases of bones and joints, for long-term drainage of cavities of osteomyelitis. For example, chronic osteomyelitis should be treated post-operatively with flowing drainage. The doctors used physiological solution for simple leaving of the bacteria, or antiseptic solutions for elimination of the bacteria from the wound by antiseptics. Second type of antisepsis, chemical. Next type of antisepsis is a chemical type. We can use some drugs, antiseptics, for treatment of patients, for prophylaxis of infection, or for treatment of manifest infection in the wound. We can use drugs which tolerant to soft tissues. They mustn't cause any harmful side effects such as chemical burns, irritations, or necrosis. We can use the following solutions. Povidone iodine. Mechanism of action is a release of free iodine that binds to bacteria and kill them and activate them. We can use field of use of the antiseptic. Perioperative skin we can use for skin decontamination before surgery, for skin decontamination after surgery, for smearing to line of sutures, and we can applicate on the povidone iodine inside the wound. The drug is very effective and very good against anaerobic bacteria. Second drug, chlorhexidine. Chlorhexidine, synonym is ibutan. Mechanism of action, rupture of the cellular membrane causing cytological and physiological changes and producing death of the bacteria. Field of use the same to povidone iodine, perioperative skin decontamination and wound application. Next drug, chlorhexidine solution plus alcohol, 0.5% of chlorhexidine solution in ethyl spirit. Idem mechanism of action, idem to chlorhexidine, but sphere of usage, field of use, skin application only. Because of presence of alcohol in the mixture, the drug mustn't be applied into under skin, only surface of skin. Hydrogen peroxide, 3% solution, 3%. There are two percentage of hydrogen peroxide. 6% solution, very strong for soft tissues, and they instantly cause deep chemical burn, so you must use 3%. Remember please. Concentration of hydrogen peroxide acceptable for human, 3% solution. Mechanism of action releases the free oxygen that oxidize bacteria and destroy them. Field of use for wound cleansing, especially in anaerobic infections. Because hydrogen peroxide produces oxygen foam, we can use this drug for cleaning of purulent and necrotic wounds. And alcohols, ethyl spirit or isopropyl spirit, for intact skin only, not for open wounds, for intact skin. Mechanism of action, dehydration to bacterial cells and denaturation of their proteins. These drugs is a base of skin decontamination. Any drugs for decontamination of surgeon hands and patient skin before surgery, I mean operation site, based on alcohols. Biological antisepsis. Biological antisepsis divided into two types. First group of biological factors which alter pathogens directly. This is direct biological antisepsis. And biological factors which damage bacteria by indirect way. Direct biological antisepsis kill bacteria directly. First biological agent is antibiotic. Antibiotics Nowadays we have a lot of antibiotics against many bacteria. We have universal, broad-spectrum antibiotics or specialized antibiotics for elimination of definite type of bacteria, for example, mycobacteria. Classification of antibiotics, general classification, you will learn in pharmacology. In surgery, some later I demonstrate you a list of antibiotics properly used in surgery nowadays. Second, drugs from direct biological antisepsis are proteolytic enzymes. Enzymes are drugs for lysis of soft tissues. They can destroy, enzymes can destroy bacteria directly and destroy necrotic tissues to prevent of colonization of necrosis by bacteria, and can dissolve and destroy biological exudate, for example, pus. They can dilute the pus as a medium for bacteria growth. Two methods of application of proteolytic enzymes: topical application or systemic therapy. Topical application means inserting of proteolytic enzymes in the wound. Systemic applications, tablets or intravenous injections or infusions. Topical effect based on inactivation of necrosis and pathological exudates. Systemic effect of proteolytic enzymes based on anti-inflammatory treatment. Specific passive immunization includes antibacterial serum, gamma globulin, toxoid, and hyperimmune plasma. All these drugs contains antibodies against infection, against pathogens. We have anti-staphylococcal immunoglobulin, anti-streptococcal immunoglobulin, anti-E. coli immunoglobulin, and we can use for passive immunization. It means we can give additional donors antibodies to recipient, to our patient, if the immune system of the patient significantly suppressed and cannot produce its own antibodies. We can restore pool of antibodies by donation of external mediums. Indirect types of biological antisepsis. First group, stimulation to non-specific resistance. We can stimulate the resistance of patient's body to infection. Intravenous blood irradiation. Special catheters for ultraviolet or laser irradiator inserted on the tip of the catheter. And the doctor inject the intravenous catheter with irradiator, and bloodstream irradiates by ultraviolet or laser rays. It method stimulates patient's resistance to bacteria. Stimulation to non-specific immunity. Stimulation of non-specific immunity. Vitamins, interferons, interleukins. All they can improve immunity, response, strength of immunity against bacteria. And last type of indirect biological antisepsis is a specific active immunization. The method includes vaccination, vaccines. We can give vaccines, pathogens with a reduced activity. Vaccine is a inactivated pathogen. Inactivated cell, bacterial cell, has all necessary antigens for provoking of immune response of the patient, and the immunity of the patient will produce antibodies to inactivated bacterial cell or viral cell. Biological antisepsis, antibiotics. Antibiotics is a classic example of direct antisepsis. Mechanism of action of antibiotics depend on chemical structure of the antibiotic. There are a few targets for antibiotics. For example, they can damage of cell wall or bacterial wall. They can inhibit synthesis of protein or bacterial wall, and they can alter to DNA synthesis. Example of bacteria which damage cell wall. Beta-lactams. Beta-lactams includes penicillin, cephalosporins, and carbapenems. They have very broad spectrum of action. They active to practically to any non-specific bacteria. Then can damage gram-positive cocci or gram-negative bacilli. From antibiotics which inhibit synthesis of bacterial proteins, we can distinguish lincosamides, pharmacological group lincosamides, example of clindamycin, very effective against gram-positive cocci and anaerobes. In our hospital, we use clindamycin for treatment of anaerobic infection, non-clostridial anaerobic infection, cellulitis, myositis, and skin necrosis caused by anaerobes, facultative anaerobes. Aminoglycosides, they also damage synthesis of protein. Among them we can distinguish gentamicin and amikacin. They have broad spectrum of action, especially against gram-positive cocci and gram-negative bacilli. And three groups of antibiotics which alter DNA synthesis. First group, quinolones, for example, ciprofloxacin, very effective against gram-negative bacteria but against some gram-positive cocci. Fluoroquinolones is a selective drug for treatment of retroperitoneal infection and lung infection. Class of imidazoles. Example is metronidazole, very effective against anaerobes. Not in single use, in complex with other antibiotics. We can use metronidazole in complex with cephalosporins and aminoglycosides. And other pharmacological group, rifamycin. Rifamycin, clinical example. Rifampicin is a specific drug against mycobacteria. Mycobacteria tuberculosis can be treated with rifampicin. This is specific antibiotic against mycobacteria. My lecture is finished. If you have questions, you can ask me the questions in the chat. I see many students present. 19 students present now in that moment. You can type in your questions in the chat. I will answer to you. If you have no questions, let me finish my lecture. I see. Thank you, Misha Raj Saxena. I see you again. I see you in the chat. So let me finish my lecture. Thank you for attendance. A lot of students were in the lecture. No questions. Okay. See you next time. See you next lecture.